Hello, my name is Amaya Morris. This presentation is about how a pacemaker procedure is completed. Let's begin. Hello. You may be asking yourself right now, what is a pacemaker? A pacemaker is a small device inserted under your chest. It only works when needed. The pacemaker monitors and regulates the heartbeat for those who suffer with arrhythmia, tachycardia, or bradycardia. Arrhythmia is difficulty with your heartbeat, and tachycardia is a rapid heartbeat, and bradycardia is a very slow heartbeat. Before getting the pacemaker, there are some procedures done. Basically, before your doctor decides to give you a pacemaker, there are various tests done to see what's the cause of your irregular heartbeat. The first test is called electrocardiogram, also known as ECG. This is a non-invasive test that uses sensor pads with wires called electrodes. It is placed on your chest and limbs to measure your heart's electrical impulses. Your second test, which is honestly, I think is the best test, is called Holtering monitoring. This is a portable version of ECG. Its advantage is that it is useful in diagnosing unpredictable rhythm disturbances. It also records information about electrical activity of your heart during your daily life activities for 24 to 48 hours. So basically, I think this is a very good test to give is because one, it's a portable version of the ECG. Two, it diagnoses unpredictable rhythm disturbances, which is really important. Also, it records information of your heart for like up to a day or two. Your second test, the third test is called echocardiogram. This is a non-invasive test that uses sound waves that allow your doctor to see the beating of your heart. A device called a transducer is placed on your chest, which transmit the collected echoes from heart to a machine that emits images of your heartbeat. Think of this as an ultrasound of your heartbeat. The third test is called echocardiogram. The fourth test is called the stress test. This is a test to determine if physical activity causes the patient's heart problems. For the stress test, an electrocardiogram is taken before and immediately after exercise, such as walking on a treadmill or biking or other forms of exercise. The fourth Now, as unpleasant and scary as this sounds, you'll be awake during the entire procedure. An intravenous line is inserted in your arm to transfer medication to ease your nerves. Then the area where the incision takes place is cleaned with an antibacterial soap. Then anesthesia is applied to numb the area to make sure you don't feel any pain at all. You may feel a little bit of discomfort, but you don't feel any pain. However, do not be alarmed. An intravenous line is inserted. First, the area is cut with a scalpel. Then, one or more flexible wires are inserted into the major vein next to the collarbone. This is used as a guide to your heart with the help of X-ray imagery. First, the Step 2. The ends of wires are attached in correct position of heart. The final step of procedure secures the other wires in to the pulse generator under skin beneath collarbone. The procedure aftercare. After procedure is completed, the patient will remain in hospital for a day. Sometimes it's 2 days. The pacemaker receives information about your heart rhythm, heart rate, and battery life, which is transferred to the doctor's office. The doctor will recommend the patient follow some guidelines. First, the doctor will tell the patient to avoid vigorous exercise for at least 35 days. The doctor will also warn to not apply pressure on the area. The doctor will also warn the patient to not apply pressure on the area pacemaker is implanted. Conclusion. The pacemaker may seem like a scary procedure considering you're awake as wires are being attached near your heart. However, I promise it's less painful and complicated than you may think. Thank you for viewing my presentation